Dr. Robert Lelouch, board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to kind of give you an overview recommendation from my years of experience on contraception, on birth control. So you see my individual videos on each of the different types of methods of birth control. But now I'm going to try to put it all together and give you my overall recommendations on how you should progress through life as a woman, and what is the best that I see to optimize. That doesn't mean there aren't variations. You need to individualize, get your information from your provider. But overall, there are many benefits to being on oral contraceptives, and I generally recommend oral contraceptives earlier in life and then the IUD later in life. And let me be more specific. So if you take the birth control pill in your teenage years, then that can regulate your period. It can potentially affect PMS symptoms depending on the choice of the birth control method. It can help with acne. And if you take it for 10 years, it can reduce your risk of ovarian cancer by 70%. And that's a tremendous benefit because we're still not very good at taking care of ovarian cancer if you have it. As many as 80% of women within 5 years are not alive after getting diagnosed with ovarian cancer as it stands now in 2025. Hopefully that'll get better. There are some risks to the birth control pill, and you can see the other video about blood clot, stroke, heart attack, all of those. Those are very small risks. For example, the risk of blood clots is higher with pregnancy, but those risks increase with age, which is why I recommend starting out with the birth control pill. And then later, once you've reached that 10 years, or if you have just 2 kids, then you only need 5 years of the pill to get that ovarian cancer risk reduction. So if you have had the birth control pill for a while, then you get into the phase where you want to have your children, or you're between them, and once you're done having kids, or when you really want to step up the reliability of preventing pregnancy, that's where the IUD comes in. It lasts up to 8 years, and it reduces your periods to very minimal or nothing. And it doesn't have the blood clot risk or the stroke risk and all of that. There are small risks. You can see my other videos, but they're diminished, and it's far more effective. It also is more comfortable and goes in easier if you've had a baby. Can you use the IUD when you're a teenager or before having kids? Absolutely, but generally it's a little more uncomfortable going in than if you've had kids, which it's barely noticeable. And those are the main phases. Don't forget condoms. No matter what you're on, if you're with a new partner, you need to use condoms to help prevent STDs. You should be getting your annual screen, yearly STD screen up until age 25, and then it's simple enough to ask your partner to get the same test when you're ready to get rid of condoms. Nexplanon, or the implantable sticks, not my favorite. Some women love them, some women don't. It's about 50-50 in my experience. So I don't strongly recommend it, but there is a place for it. Depo-Provera, the shot, only birth control method linked to weight gain, also linked to osteoporosis. It's a bridging method. It has limited use in my practice. Others find it great. You shouldn't use it more than a year or 2 because of the osteoporosis risk, but again, see that video. Permanent sterilization, definitely a viable option when you're absolutely done with children, but certainly that would be later in life. So that's kind of the overview where I generally steer patients. There are other methods, as you can see in the videos. There are reasons why you should flip that on its head, do it in different ones, but overall, for most of my patients, that's how I guide patients, and I think it's of value to get that kind of broad perspective. And one more thing, the copper IUD, the Paragard, or there's a new brand. It has its place if you don't want any hormones at all. It lasts 10 years. It's very effective. women generally have more cramps and bleeding with it than when the progesterone IUDs, but it's okay for you. There is a new IUD coming out with copper, supposedly smaller, only lasts 3 years. Frankly, I have zero experience with it, but I see no compelling reason to go with a 3-year one when there's a 10-year one. But again, I try to give you my experience, and this is new, and I have zero experience, so I might change my mind. Just thought I'd give you this little addition because I just read about this new copper IUD coming out yesterday, and this is March 2025. Thanks.